Welcome to another episode of the Back to School Shootings podcast. My name is David Reedman. I'm the creator of the K through 12 school shooting database. And this is the show where we have uncut conversations with the world's leading experts in preventing school shootings. And I saw an article come up in my Google alerts in this last week. And the title of this article, it's in Psychology Today. It was Recognizing Extreme Overvalued Beliefs. Non-delusional, rigidly held beliefs motivate school shooters. Well, that is exactly the kind of story that I'm going to click on immediately. And I clicked on it, I read it, I saw that there's a book that has actually just come out in September by the same title, Extreme Overvalued Beliefs. So our guest today is Dr. Tahir Rahman, and he is the author of this brand new book, Extreme Overvalued Beliefs. And he is an associate professor of psychiatry at Washington University in St. Louis. So, Dr. Tahir, thank you so much for coming to the show.
Thank you for that gracious introduction. I'm excited to be here to talk to you about a very important issue.
Okay, so before we get into your book, I like to start all these interviews with just understanding how somebody ended up in this space, because it's such a weird niche, kind of depressing field to be in, studying mass violence and studying school shootings. So you're a doctor and you're a doctor of psychiatry. What got you into this field?
Great question. I went to medical school at the University of Kansas, and that was in the 90s. And one of the big events that happened back then was the Oklahoma City bombing. And my father was a psychiatrist that probably influenced me to some degree, but I was really interested in forensics and why people do things like that, why they are killers, murderers, bombers, assassins, terrorists, and then 9/11 happened. I was in residency at Johns Hopkins, and there we used to talk about a condition or motivation for certain disorders called overvalued ideas. And it's based on the work by a neurologist, a neuroscientist, Carl Wernicke, from way back in 1892, 1900, where he had written about separating delusions, obsessions, and overvalued ideas from one another. And it's real simple. He basically said a delusion is fixed, false, idiosyncratic, and usually goes along with psychotic mental disorders like schizophrenia. And as a forensic psychiatrist, I'm asked to evaluate people for insanity. Here in the state of Missouri, for instance, we have an insanity defense. And if I see a individual who's got psychosis from schizophrenia, I can advise the attorneys on whether the insanity defense is appropriate or not. So that's called a cognitive driver, which is really important in insanity law. Because if you don't have the knowledge of wrongfulness from your psychotic illness, then you are eligible for an insanity defense. And all of these school shooters and other mass shooters, almost to a T, most of them, 80, 90% or more, don't fit that category. So I set out to really explore historically what are overvalued ideas, because Wernicke said that they were beliefs that were shared by others in a person's culture, religion, subculture. And if you really read his descriptions, these are people who relish, amplify, and defend their beliefs. And the closest analogy I can tell you about with overvalued ideas are eating disorders, body dysmorphic disorders. These are individuals who will go out and get multiple surgeries for what they perceive as being defects in their body, 5 nose surgeries. And incels, the involuntary celibate, terrorism, misogyny, they also share this kind of body habitus and body dysmorphic problem. And they relish, amplify, defend it. They share it with other people. They post images of themselves on the internet and then attack each other about how ugly they are. It's really a depraved subculture. And the school shooters also share ideologically their grievances, whatever they may be in life, they start relishing these prior shooters. And this starts getting into how, similar to an eating disorder or body dysmorphic disorder, um, how an individual starts going down that rabbit hole. And just to give you a quick example, the Parkland shooter at Marjorie Stoneman Douglas High School in Parkland, Florida, Nicholas Cruz, when he was interviewed by forensic psychiatrists after his attack and during his trial, the psychiatrist didn't think that he was insane. In fact, they thought that he totally understood all of the aspects of what he was doing. And so that legal principle helps us understand a little bit of where we're coming from here. And he actually started studying the Columbine shooters starting in 8th grade. And so we call that cognitive inoculation, where you see or learn something early in your grievance pattern or your radicalization pattern. And that brings me to, what are we doing with school shooter drills? Because when you're practicing school shooter drills and you already have a grievance against your school, maybe your family's dysfunctional, there's other things going on in life psychologically. And we see this with eating disorders too. Exploring these depraved subcultures kind of becomes a temptation. Um, if you're a young lady and you're not popular and maybe you're overweight or think you're overweight, exploring ways of dieting to become more attractive and then getting that positive reinforcement from your friends does nothing but escalate that behavior. And studies show us that people really have a hard time of breaking free from that once it starts. And so these are called overvalued ideas. I also want to differentiate them from obsessions because obsessions are actually ego dystonic. In other words, the person doesn't like the thought that they're having. And those are rare in terms of violence propensity. So if an individual, for instance, thinks that their hands are contaminated with germs and they're washing it 50 times a day and they're bleeding on their hands from too much uh, overwashing and have this intense fear that the germs are going to create an illness for them, it becomes a dysfunctional world for them. And they will seek out help often from doctors that they have this OCD, obsessive compulsive disorder problem. They'll respond to things like cognitive behavioral therapy and medications. Even deep brain stimulation can help in severe refractory cases. So that's called an obsession. And that's very well known in psychiatry. It's a very distinct disorder. So, all I'm really trying to highlight here for mental health workers, psychologists, social workers, psychiatrists, law enforcement, legal professionals, is that these three entities, obsession, delusion, overvalued idea, have been in the psychiatry lexicon for over 125 years. And we need to now start applying them because they're coming to the forefront due to social media, other ways that people interact with one another now that are very different than what we used to have in the past. Although these overvalued ideas have been around for as long as humanity's been around. There was very limited internet or no internet when the Columbine shooters did their thing, for instance. So this isn't social media isn't the cause of it, but it's the host and vector of it, kind of like a mosquito carrying malaria. It's harboring these things, and kids who have a grievance, have a mood disorder, an anxiety disorder, autism spectrum, any of those things may be vulnerable to these cognitive shortcuts that happen when they're exploring these different ideologies online. So we know that depression doesn't make you into a mass shooter. Autism doesn't make a person into a mass shooter. Anxiety doesn't make a person into a mass shooter. But if you mix together the grievances that you might hold, the dysfunction that might be happening around you at home, in school, other places, exploring these ideologies may become more readily accessible to your mind in terms of gee, I need a way out of my life, and other people have done this with the benefit of fame, notoriety. And just to give you an example from a recent case, we saw Thomas Crooks, the guy who took a shot at President Trump during the Trump rally, um, instant fame for taking these shots. He killed somebody as well, but he has his profile on Wikipedia now. His photograph is there, his whole story is there, his life is there. So instant fame and notoriety come to those who are missing those things in their life for some reason. So
So
people,
to back up for a
yeah, yeah,
moment,
go
because
ahead.
I think it's a really important part that I don't want to get lost. There's a tremendous amount of public rhetoric and rhetoric from some prominent politicians about school shooters being psychotic, school shootings and mass shootings being a product of severe mental illness. Can you just expand a little bit on the distinction between severe mental illness, somebody who's paranoid schizophrenic, somebody who's experiencing psychosis, versus somebody that has these overvalued beliefs?
It's a great question. It's very important. So psychosis is something that's the first thing you learn about when you become a psychiatrist, right? You have a person admitted from the emergency room who's hearing voices, believing things that aren't real, maybe seeing things that really aren't there. And it's really a devastating condition for many people. Interestingly, those individuals don't generally harm others. And if they do harm others, it's not the public, it's their family or their neighbors, people who are trying to help them. And they're getting paranoid about them. They might think that their family members are trying to poison them, trying to harm them, and they may get aggressive toward them in a way that they're trying to protect themselves. Most of these individuals don't go out and do a mass shooting or active targeted violence. They're more likely to be a victim of violence from others who are trying to steal their money, or they're just walking down the street and a group of people will beat them up, for instance. So they're usually harmed by others. They're not perpetrators. And they're treated with antipsychotic medications, which generally work pretty well. And we've gotten better at those kinds of treatments. There's new medicines coming out all the time. But those individuals have delusional beliefs often. And that's what's used in legal proceedings for insanity is most often the case, that they're what we call the mens rea, or the guilty conscience of their mind, has to be evaluated.
And
So
so
the
in
law,
that delusion, they're detached from reality in
yeah,
that
I'll
delusion.
give you a great example is Andrea Yates. She was the um, young mother who had 5 children, and she was valedictorian of her high school class. She was very intelligent, very religious also, but she also developed a psychotic illness from postpartum depression and started believing things that were totally detached from reality. And she thought that by drowning her children, that their souls would not be condemned to hell, and that by dying before the age of accountability in the Bible, that their souls would somehow be saved in this depraved psychotic
Yeah,
episode.
that delusion seems to blend like the science fiction elements with the real world. I mean, I've studied hundreds of both carried out attacks, but also averted attacks. There are very few that are that severe psychosis. I mean, the most famous example, I think, is in 1989 in Stockton, California, at Cleveland Elementary. And that was a man who was homeless. He was paranoid schizophrenic. He thought that the school was sending mind control beams to him, and his attack there was against this mythical force. There was an averted shooting last year where there was a man who thought that he had to kill a certain number of kids at the school to open up a portal to another dimension where all these other people were trapped. But fortunately, he was so delusional that he thought somebody else was going to commit the shooting with him, and that person was going to bring the guns. So he showed up at the school in a psychotic state. Fortunately, had no weapons with him, but he spoke very articulately about this plan that he had to kill these kids to free all these people from another dimension.
So what I want your listeners to really understand is that if an individual comes to the emergency room at a hospital and has those kinds of symptoms, fixed false beliefs, delusions, hallucinations, disorganized speech, behavior. Maybe they're walking outside without any clothes on and rambling speech. People can't even tell what they're saying. Sometimes people, when they get dementia, they'll develop delusions too. And a lot of people are familiar with that because they've seen grandparents or relatives develop those kinds of things. That's very similar. Those kinds of symptoms are very similar to what a person with schizophrenia might develop at a young age, but a little bit different disease process. So, what we're really looking at with those cases is you can hospitalize them, you can civilly commit them. You can fill out a form that says 96 hours in the state of Missouri, for instance. It's different in every state for civil commitment to a psychiatric facility where you can involuntarily hold them. And in many states, you can involuntarily medicate them with forcible medication treatment, which works to get rid of some of these symptoms and get them more functional so they can then leave the hospital, be home safely, and be back with their families in many cases.
And
Um,
it's important to note that those cases, well, the details of them are shocking. They are extraordinarily rare.
they are.
Hundreds of cases of school shootings or averted attacks. Very, very few have that true psychosis,
Yeah.
have the delusional person.
And the
The,
only reason we even talk about it is because of what you said, what politicians are saying, what lay people are thinking about as psychotic. That's psychotic, what we just talked about. And that's not what these school shooters generally are, just to clarify why we're talking about this. And obsessions, same thing. Those are individuals who usually come to the clinic and say they want help because they can't stop thinking about washing their hands, having germs, checking things, counting things, rituals, starting all over again if they mess something up, like folding their clothes or getting ready to eat a meal. And it's very disabling for those people. And they want help with it. That's called an obsession. Again, very different from a delusion and has a very different treatment and course and outcome too. Now let's get over to the back to the subject matter of extreme overvalued beliefs. This is very different, and it's the most similar thing we have to that people might be able to understand are the eating disorders like anorexia nervosa or bulimia, where there's a relished, amplified commitment, intense emotional commitment to weight loss. And almost like the religious fervor, the person will start pursuing this course of action of dieting, exercising, trying to slim and achieve a lower weight, which is then believed in their mind to equate to a better life. But it's very misguided, and eventually they get to a place where they just can't stop, and there may be brain changes occurring that we don't quite understand in those cases. But something similar happens in the mind and brain of a person who becomes one of these shooters, where pursuing this ideological depraved subculture becomes part of their life and their amplification and defending that behavior becomes a bigger and bigger thing as it grows in their mind, becoming more dominant, more refined, more binary, simplistic, and absolute. And to give you an example of that, we all know what happened on September 11 when terrorists attacked the World Trade Center and the Pentagon. And in those situations, we had 19 hijackers who believed that it's the duty of every Muslim person to have the West leave the Holy Lands in Saudi Arabia. So that was a very specific grievance many of those terrorists had. And that the West is fundamentally at war with Islam, and that binary, simplistic, and absolute thinking led to those terror attacks. And on the U.S. Capitol attack, we saw individuals who believe that the election had been stolen, that Biden is a communist, that um, it's time to take the country back and hang Mike Pence. So many members of QAnon, for instance, and other radical groups joined in on this, but so did many people who actually had no affiliation with the Proud Boys or the Three Percenters or any of those other groups. And there was a wonderful study done by Dr. Robert Pape at the University of Chicago, where he studied the January 6 attacks and found that roughly half of them were professionals. And some of them were doctors, lawyers, uh, business owners. And they were from, many of them were from blue states, blue counties, and not from, where what you might stereotypically think that they're rural people who are interested in the MAGA movement. And that didn't happen with uh, many of these individuals. Many of them were from blue states. And a lot of them believed in the great replacement theory that black people are replacing white people in society. And, one of the shooters, Peyton Gendron, 18-year-old guy who did the attack in Buffalo, New York, on the Tops grocery store, had exactly that ideology. His intention was to go in and shoot black people, with this great replacement theory being in his mind, uh, in
And,
terms of
and interestingly, in his extensive writing on Discord, he considered attacking an elementary school, which is very strange because that doesn't fit. Where somebody who attacks a school almost always is a current or former student that has a grievance that's rooted in that specific school and something specific to that school community.
something on that. I didn't know that about Gendron. So yeah, these it, a lot of people that have looked even at Crook's case, he really probably was looking at doing a mass shooting. Uh, the Trump rally shooter,
Mhm.
Tom Brooks.
Yeah, I wrote an article about how similar he is to school shooters, and essentially you could take any of the pieces of that history and apply it, and he's just a slightly older version of a school shooter, and that's I think what separates shootings in mass public places from school shootings is when somebody is a young child or a teenager. The school is the nexus of their entire community, their entire social life revolves around that school. So the grievances become rooted in that school.
Right.
Once somebody's a young adult, they have a workplace, they have an ex's workplace, they have their old school, they have a university, they have a bar that they go to. There are all of these different places that could become where that grievance becomes focused.
And they don't just snap one day. They've been thinking about this for a long time. Uh, Getting back to Nicholas Cruz at Marjorie Stoneman Douglas High School in Parkland, Florida, he posted, "I'm going to be a professional school shooter" on YouTube, 6, 7 months before the attack. And so here you have clear evidence that individuals have been thinking about this. And when you interview them, when forensic psychiatrists interview them, this is exactly what they find, that they thought about this and fantasized about it for many months or even years in some
Yeah,
cases.
I think that's another point that's really important is the thought that well, somebody is going to snap and then they're just going to go to the easiest, most vulnerable place to kill as many people as possible. But with the school shooter, that is not the case. There's usually planning for weeks, months, often years, and it's directly connected to specific places and people. I think the details that have come out about the 14-year-old in Georgia at Appalachia High School, that shows the amount of time that goes into thinking about this violence. That 3 years before the shooting, when he was 11 years old, he was caught um, on his school computer searching how to kill his father. So somebody who's thinking about very specific violence from a young age. A full year before the shooting, he posted online 2 pictures of the rifles that he had access to and made multiple posts saying, I am ready to be a school shooter. I am ready to be a mass shooter, but kind of reaching out then to the community for support, to his online subculture for support. So what I'm interested in hearing more about is how do these highly individualized traumas, so in the case of the Georgia school shooter, being abused by both of his parents, being put out of his house, being bullied, being dirty, being taken by child protective services multiple times, but then just returned back to his parents with no changes. He took all of this individual trauma and projected it into violence at a school that he barely knew anyone there. He had just started attending. What what happens, in that transition?
Great question. So people who have had traumas, some of them, not all of them, will develop personality vulnerabilities. So we sometimes call these, for instance, I didn't examine any of the shooters we're talking about, but just to give you an example, um, a borderline personality or narcissistic personality can come out of horrible traumatic experiences. And attachment theory helps us understand some of that. So Melanie Klein, Otto Kernberg, and other psychiatrists, psychologists have studied attachment theory extensively. And what we think is happening is instead of attaching to a person, for example, a girlfriend, which would be for some of these boys a healthier relationship, or even just healthy relationships with friends. Instead of developing those healthy relationships, they kind of become dichotomous. In other words, they split and they'll develop an overvalued attachment either to a dysfunctional person who they both will devalue and overvalue, or a dysfunctional ideology, which they can easily overvalue. And without getting into too much of theory of psychology about how that happens, it's just important to know that they can't integrate very well um, who they love and who they hate. And so being able to understand that one person can have both good and bad elements is difficult for them to do. So they'll tend to split into two groups. I hate these people and I like these people. So if they're starting to develop a grievance towards schoolmates, let's say that they perceive or are being outcast, ostracized, maybe bullied. Bullying doesn't cause mass shooters, but maybe that's happening to this kid who has a personality vulnerability. Now, fantasizing about harming them becomes into the picture. And many kids fantasize about harming their kids, but the ones who have this personality organization that's dysfunctional is going to start overvaluing and looking for solutions in their um, defective way of thinking, you can think of it, and developing attachments to ideologies. And we all know what attaching to an ideology is like because, for instance, I love watching sports, Kansas City Chiefs. That's a fixation that is healthy, normal, I hope. For some people, it gets a little bit over the top. Most people don't, most Kansas City Chiefs fans don't want to go blow up, the Raiders fans because they know that it's just a sport. But a person with an abnormal personality who has a moral grievance, that's different than just a fixation. It's a moral grievance, like the 9/11 hijackers, moral grievance based on religion. The September, or rather, the U.S. Capitol attack, a moral grievance. The U.S. Constitution is under attack. And with the school shooter, there's a moral grievance too. You're not including me in talking about classmates, you guys aren't including me in life, in fun. I don't have the pretty girls that you guys have. I don't have the athletic stardom that you guys have. I don't have the cool clothes that you guys have. I don't have any of the things you guys have. Therefore, I can seek and be better than you by going into one of these deep subcultures of hate and relishing it. Remember, these are positive emotions. So when they go into one of these forums, they're not thinking, I'm sad and I'm just going to go um, take my sorrows out. This is a dopamine hit. Like, I get to be famous. I'm going to be a big shot. These people are all going to know who I am when I'm done. That,
Yeah, I think the
that,
most recent example of that really comes to mind is at Perry Middle and High School in Iowa at the very start of January. And that was a student that, by accounts, had been pretty extensively bullied, and then bullying was then extending to his younger sibling, and that's the point where the attack was kind of motivated. But he was in a Discord channel that was school massacres discussion, and he had been very active in this Discord channel, and you could see that he was making posts the morning of the shooting about I'm going to do this. I'm ready to do this, waiting for other people to say, you have this. He took a shotgun in his duffel bag into the school, went into the bathroom, and he sat there in the bathroom posting to the school shooting massacres discussion. And his final post was posting the same song that was playing on the Columbine shooters mixtape. So showing that he's working within this ideology, that he feels powerless. He feels this moral grievance around not only is he attacked, but now his sibling is also attacked. And there's this source of power coming from being in that subgroup. But
Please stated, David. I love that analysis that you just did.
well, thank you. That case makes sense. But what doesn't make any sense is just a couple months later um, at Mount Horeb Middle in Wisconsin, there was a 14-year-old student, and in his posts, he described himself as being addicted to school shootings, that he was just addicted to learning everything about them. He didn't have any sort of articulated trauma or belief or grievance, but he was obsessed with school shootings. He wrote about convincing his parents to take him to the site of a school shooting. And when he got onto that school campus, he just felt this incredible energy coming from the campus.
Yeah.
And so his family was anti-gun. He didn't have access to any guns. He took a realistic air rifle to the school with a backpack that had a bunch of improvised explosives. And when he tried to get into the cafeteria, he was killed by the school resource officer. But what I'm interested in that is it seems like there's some crossover between obsession and the overvalued beliefs. Can you talk about kind of the distinction or overlap between those?
Absolutely. I think it's a very important distinction. I think that we've all loosely and interchangeably used these terms because the term that I'm really trying to get out there, which has been around in psychiatry for 125 years, of overvalued beliefs or ideas, is relishing the thought, enjoying the consumption of it. And the individual might have a word like obsession that they use, or they might say that they're really fixated on it because our lexicon in pop culture says that that's what it is. So if I have a room full of Chiefs, Kansas City Chiefs stuff, people might say Dr. Rahman is obsessed with the Kansas City Chiefs. But I'm not obsessed with the Kansas City Chiefs. I'm enjoying the Kansas City Chiefs. I am relishing it. I love it. I want more of it. Obsessional people can't stop the thought that they are trying to fight or resist or block. And it's rare for these individuals with true obsessions to carry out harm or violence towards other people. That's just rare. One notable example of that might have been Charles Whitman, the Texas Tower shooter, who actually wrote that he couldn't stop having the thoughts and he wanted them to go away. And he turned out to have a small brain tumor, glioblastoma, near the amygdala in his brain. And so some researchers in my book I've written about this think that that might have actually been an obsession where he just couldn't get rid of the thought. And it's possible that some of these early cases have made researchers go down that road more, that there's some kind of brain defect that causes mass shooters. But people have ignored this contagion and copycat effect, which is really what's in extreme overvalued beliefs, because it's a subculture, it's an ideology. And think of it as like a religious fervor that involves glorifying guns, glorifying killing, glorifying fame, and you get to be a big shot and famous instantly, and you get to show everybody in your school or in your community that you really are something. You're not a nobody. And often these kids are told that they're a nobody or a nothing by their family, by their schools, by peers.
Which makes me wonder, to get back to your point that you made earlier about lockdown drills. So if somebody feels like a nobody, somebody feels that they're forgotten or marginalized or invisible, is a term that's appeared in a lot of the manifestos that I've read.
Yeah,
A lockdown drill is rehearsing this scenario where one person has complete power and control and visibility, that every single person in the school is going to pay attention. Every single person in the school is going to be scared. Every person in the school is going to hide. How I personally believe that lockdown drills are teaching a kid to become a school shooter. Where do you see the psychology of experiencing those lockdown drills being something that might build or motivate a fascination of somebody who's predisposed to this?
I am so glad you said that because if there's anything that we can do to slow this contagion and copycat of this subculture down, it's to stop doing the school shooter drills or at least balance them with other information because schools treat it like an earthquake or tornado drill. Here in the Midwest, we have a lot of tornadoes, and those are natural disasters. Well, this thing is not a natural disaster. This is a subculture. So it would be kind of like doing a dieting drill and then seeing how many people develop anorexia from that.
Well, we did that experiment in the 90s with the DARE program.
Yeah,
And empirical evidence shows that actually it really was a poor program. And I see
yeah,
a lot of parallels between DARE was a bunch of ideas that were not rooted in empirical evidence that some people institutionalized. And then once it was institutionalized, it became standard across the country. Lockdown drills are the same way. There's never been an empirical study in any capacity of the effectiveness of lockdown drills. And when I've looked at 230 different deliberate attacks at schools since 1966, more than half of them begin and end in exactly the same room. So, what are you even training for in that? The most common school shooting scenario is a current student commits a surprise attack that starts inside the school building during morning classes. So, when you create policy and practices based on fantasy instead of evidence, you actually might be creating an even worse outcome for everybody.
and, and so sometimes people say to me, "Well, you don't have any evidence-based data," and and you're exactly right with your argument of how they don't have evidence-based data for doing the shooter drill as
Well,
being.
in the 20 years since lockdown drills and securitization of schools became really widespread across the country, there have been more shootings that have more injuries and fatalities than they did prior to the beginnings of these drills. I mean, I think of Jonesboro, Arkansas in 1998. This is the year before Columbine. It's a 12 and a 13-year-old student. They're current students at the school. They go outside, have guns staged in the bushes. One of them pulls the fire alarm. And when all of the kids start evacuating for the fire alarm, they start shooting from the tree line. Well, the classmates and teachers hear gunshots, so they run away and go back into the school. You didn't need to rehearse for that emergency. People innately know to either have a fight or a flight response. That's ingrained in us. We're responding to a fire drill, things change, there are gunshots, we're going to go the opposite direction. You don't ever need to practice that. You were just going to do that.
So getting into the psychology of that a little bit, because I think you're 100% correct about this, is let's say that you were teased or bullied that week and you already kind of don't like your classmates and maybe you have one of these attachment disorders that I'm talking about because of your personality organization makes you attached to ideologies faster. And then you see one of these cool shooter drills. That's the fantasy, the power over everybody, like you just said. That's the fantasy. And All of these targeted attackers like assassins, terrorists, school shooters often have this fantasy of what's going to happen when they carry out their deeds. And then they start researching it. And that then becomes like a religious ideology for them. So for many people, patients who have eating disorders or intense ideologies of radicalization, there's a real parallel there between what you're talking about and what we see clinically. And they can be very hard to resist for these patients. It's hard for them to think of other things and not be so preoccupied to a pathological degree on their fixation. And getting back to the legal system, ideologies don't excuse you from breaking the law. In other words, if you really thought that, Trump won the election and Biden's a communist and hang Mike Pence, if you really thought that, which these individuals did, the law says you can't use that to be off on insanity. They view it more like a cult, like you fell into a cult and you don't have a severe mental illness like schizophrenia. So you can't use that for insanity. So when we start getting into debate about what's a mental illness, this is it right here. You can't use ideology for a mental illness in the legal system. You can't civilly commit somebody to a hospital for an ideology, for a religion, political belief, weird, depraved subculture that you learn online about shooting a school. Those are ideological things. They're not driven by a severe mental illness.
So
And
the bad news with
antipsychotic
that,
drugs, let me just say real quick, antipsychotic drugs don't fix that. Giving Haldol or antipsychotics to the January Sixers would not make them stop their attack on the Capitol or the 9/11 hijackers or the school shooters like Nicholas Cruz. They're not going to get better with antipsychotic drugs, which is what psychotic illnesses are. And they're not excusable in the legal system for insanity. That's why understanding these cognitive drivers of fixation, delusion, obsession, extreme overvalued beliefs, that's why differentiating these three entities is so important. I want every American to know what they are because we can't stop them if you don't understand what they are. And knowing the mechanism of anything, whether it's cancer, heart disease, high blood pressure, or school shooter, if you know the mechanism, you can stop it. And using concise definitions will get us down the path to stopping these shooters. And what you highlighted here in this very short time about the school shooter drills is one very important aspect. And other things are group dynamics, access to these kinds of subcultures online. What if parents could, like we do for pornography, where you can turn off access? What if we could turn off access in your house to Columbine shooters? How much effect would that have? So parental controls, maybe something we could intervene on. And then the other thing is cognitive dissonance training, which means the discussion you and I are having now, every kid should learn in school. This is what makes a school shooter, not schizophrenia, not depression, not that autistic kid that's in your class. He's not going to hurt anybody. Get rid of those myths. Instead, talk about the shared subcultural ideologies where kids learn this stuff and teach it to one another because we know that peer influences are actually the strongest ways of stopping these kinds of things. And we know that from radicalized individuals. So if you have radical jihadists, radical white supremacists, neo-Nazis, peers are the ones who help de-radicalize them better than a therapist or a psychiatrist. Certainly
or get an adult involved for
get
some
involved.
meaningful intervention. I have
Sure.
a paper that has been in peer review for forever, studying 125 averted school shootings. And one of the ways that the data is coded is for how the plot was detected. And more than 80% of these averted school shootings, and to meet that category, somebody needed to have intent planning, and some attempt at capability. So things like they were assembling weapons, they had a hit list and manifesto, and they were doing it for this reason. But something stopped the attack before it happened. 80% of the time, it was another student at the school alerting an adult that there was a problem. And the only way that you can do that is education and a trusting environment where kids know that they'll be heard and they know that there will be meaningful actions taken. But I'm actually kind of concerned hearing about the parallels to addiction and body dysmorphia and eating disorders, because those are lifelong battles where somebody needs continued support so that they don't fall back into
Yeah,
a pattern. It would be much easier if all school shooters were psychotic because we could just medicate them.
yeah, that's right.
But what kind of tangible things need to be done that can actually make a difference once somebody starts to develop these really ingrained, overvalued beliefs?
Great. Your observation is 100% spot on. So the the first part of what you said is absolutely correct. That once you go that way, once you develop a disorder, it's really hard to undo it. So what happens if you try to prevent it? Well, here's the good news, and here's the discussion we need to start having is prevention works. In other words, when we train young, for example, women, girls about eating disorders and do cognitive dissonance exercises with them before they develop anything, just healthy person, if you do those exercises with them, they have a 67% decreased risk of developing an eating disorder, which is absolutely huge. That effect size is huge. This was done by Dr. Eric Stice, and the project is called the Body Project. And it's been used in over 3.5 million girls, young women worldwide. And it has been shown to be very effective in decreasing the risk of developing an eating disorder. And any eating disorder expert will tell you that if you can stop it from starting to begin with, the patients I've treated say the same thing. If you stop this from happening at the beginning in adolescence, for instance, it's much easier to um, stop this contagion effect than if you wait. And so, what we need to be doing and what we need to start developing are extreme overvalued belief educational programs for kids in schools and show them how radicalization happens in all of these areas that we're talking about: eating disorders, drug and alcohol use, you know, um, gun violence, glorifying guns, glorifying killing, depraved subcultures. Show the kids what this stuff looks like. And we are paralyzed by fear. We think that talking about this stuff will make people go research it more. And I think that the exact opposite is what's true. And you know what? The kids can take the leadership role in this. The kids can help train the older kids can help train the younger kids about what to stay out of and why it's important not to go down these rabbit holes, and what parents can do to block or monitor uh, social media access at home, and maybe even force internet companies to allow parental access controls for depraved subcultures where you just can't go into them at home anymore. Um, we do that. We've done that for things like pornography. There are ways that parents can block pornography on internet channels, and this violent stuff is more dangerous than pornography. So we've trained everybody that those things are bad to look out for. But it turns out that these like Discord subcultures of identifying as a shooter and killer, that's the danger to our society. And none of us saw this coming. Nobody saw that this was going to happen in the 90s when the dawn of the internet was starting. People in my field were very concerned about sexual stuff online, which is dangerous. You know, there are sexual predators that stalk children online. I don't want to minimize that. But the danger from this gun violence has more to do with ideological subcultures in these depraved sewers of the internet that kids can go into.
Yeah,
And
and the warning signs were there in many ways. We just missed them in so many capacities. And I mean, I think in the early '90s, pre-internet, when Doom was the most
yeah,
graphic video game out there, and you'd laugh
yeah,
at looking at it today.
that's right.
Stephen King wrote a book in the early '90s called Rage, and it was a book that depicted in detail a school shooting plot. And there are about a dozen school shootings in the '90s where the manifestos or the writings of the shooters or what they wore were all based and rooted in that fictional book Rage. And as a result, it was pulled from the bookshelves everywhere. But there's still copies online. I mean, I have a copy that I
Great.
found online.
Great.
And these things. I just coming back to the start of the conversation, you talked about Oklahoma City bombing as being one of your pieces of motivation, and it's so connected to school shootings. Is back in 1966, Charles Mason, who's the godfather of the American neo-Nazi movement, he started writing journal entries. And in 1966, his journal entry was about being at a school, a boys' school, and because of discipline at that school, he was going to be sent to a military school. And so he said that he was going to there were guns all over his house. He was going to take a gun from his father. He was going to go to the school and kill the principal and the assistant principal and three of the teachers there and then kill himself. And that book became a far right kind of icon. Um, the book is called The Siege, right after Charlottesville. Reed Siege was a hashtag that was trending with these far right groups. Well, Siege was circulating as the neo Nazis were growing in the '80s. And that has your roots into Ruby Ridge and into Waco. And Oklahoma City was a response to Waco. And Columbine was planned as a bombing that was going to be a bigger bombing than Oklahoma City. But when we never said that we are going to label these attacks for what they are, we're going to call out these subgroups that are for decades promoting violence across our country, then of course they're going to live in the dark, unmonitored corners of the internet because we've let them fester for 60 years.
Very eloquently stated. You're absolutely right. And we know that there's suicidality involved in some of these, and I want to touch on that real quick too because it's important. Because my colleagues will sometimes say, "Well, don't these guys kill themselves, or they know that they're going to get killed? Isn't that like a sign of that there's something wrong with their brain in terms of depression or something like that?" And the response is that people can develop a collective ideology of suicide. Nothing is more uh, a good example of that than 9/11. So, 19 hijackers flew into buildings committing suicide. Palestinian suicide bombers have long been known to kill themselves with this collective ideology. And so people are willing to fight and die for an ideology, is the bottom line. So there's no reason why we shouldn't be surprised that an individual can interact on an online forum and develop an ideology of both homicide and suicide, knowing darn well that they're going to end their life or the police will end their life for them as part of the ideology. And people sometimes have a hard time getting that. But when I use the analogies of the subcultures from uh, cults, it becomes more easy for people to see. Um, the Heaven's Gate cult is another example. So we had uh, 39 people commit suicide under this pastor, Marshall Applewhite, who convinced them that their souls were going to go to the comet Hale-Bopp and to a comet. And these beliefs, which were shared by all of the members of this cult, led to their exhilarating, by the way, you can find some videos that they posted online before they died, an exhilarating ideology of death. That they will die and their souls will go to this comet. And um, it's a really fascinating exploration to look at some of the cult like beliefs that can lead to suicide. And so homicide suicide should be thought of as a collective ideology as opposed to a defect of the brain that leads to a mood disorder that we can civilly commit them and get them um, somehow treated in a hospital. That's not at all what's going on here. In fact, if you got one of these school shooters to the hospital before they did it, most people wouldn't be able to detect it because it's going to be their secret fantasy. They're not going to tell the psychiatrist or psychologist in the hospital that they're having thoughts of shooting the school. Some of them do. Most
Yeah,
of them,
and I think that that's, really displayed. I went through the manifestos of the Central Visual Performing Arts school shooter with Dr. Jill Peterson, who's a forensic psychologist. And
yes, she came here
it,
and gave her grand rounds, by the way.
yeah, and that manifesto details that he was hospitalized multiple times, but never found to have, outside of depression and suicidal ideation, he didn't have an underlying um, major psychological disorder. And because of that, he was never admitted. He was never, there wasn't any treatment
Yeah,
to kind of give him.
that's right. So I want your viewers to understand when you go to see a doctor, a psychologist, or psychiatrist, or social worker, or any of the mental health professionals, we don't ask people if they're having fantasies of killing other people. That's not a mental status exam. We ask them if they're having thoughts of harming self or others. But we don't say, hey, do you fantasize about blowing up your school or killing your classmates? Do you have deep fantasies that you explore online? You know, sometimes those things will come out by pure accident because a mother knows that it's happening or she'll run across it. Or the kid might leak that information out. We call that leakage in threat assessment. So they'll leak that information out. And so we know that it's happening. And then, the law enforcement may come knock on their door. But we do a poor job of funding threat assessment and management teams in these cases also. So
Yeah, and
that's
those pieces just don't come together. I mean, that's uh, all the information that's come out about the school shooting in Georgia last month
right.
is that the kid and his father were interviewed by 5 different police agencies.
Right.
He was under care of social services, child services, at least 6 times. He'd been at 5 different schools in a short period of time, and
And
every one of them had pieces of information, but when they all were scattered, none of it got connected. And I think you've brought up 9/11, 4 or 5 times during this interview. It is the same problem over and over where 9/11 was preventable. The entire system was blinking red. There's an 800-page 9/11 commission report about how we knew everything that was going to happen. We just didn't put the pieces together. And with each one of these school shootings, it's exactly the same way. There are all of these pieces that were there for months or years before the attack. So just to kind of wrap things up here, I think there are 5 really big points that we hit in there. That there needs to be education at all levels about radicalization. And the Body Project, which has existed across the world, is an example of how this can work. Countering that, as we're giving education, we can't reinforce problems. So we need to stop rehearsing how to be a school shooter. We need to stop having lockdown drills in the school because they don't help during the shooting, and they might be training and inspiring somebody who's impressionable and somebody who's in this mental state where they're thinking about these extreme overvalued beliefs. With those 2 pieces of education and not reinforcing the power of a school shooter, we need to be engaging peers in understanding their role in supporting classmates and preventing these attacks. And with that, we need to be exposing and addressing and eliminating these safe havens for subcultures to share very dangerous ideologies and belief systems around hate and violence. And lastly, what connects all of these is school shootings and mass public shootings are driven by an ideology. not by a severe mental illness, not by something we can give a pill to somebody, but something that you need all of those different elements. So, Dr. Robin, is there anything else that you would want to leave the listeners with?
That was very well wrapped up there and succinctly, but very succinctly. The last part of it, I would say, is if a person is identified as being opposing a threat to a school, the last thing a psychiatrist wants is for that kid to be in their office. And that makes sense, right? Why would you want a shooter sitting in your waiting room with all these other little kids who are innocent, and don't have security and protection for them either in our offices? We don't want these people coming to the hospital. So the instinct of our field in psychiatry and psychologists is get these people to law enforcement. That's for the cops to deal with. Well, the cops look at that and go, this guy's got a messed up house. This guy's got a father who's an alcoholic or, is absent, has a mother who's dysfunctional and doesn't know how to enforce rules, has peers that are bullying him at school that he feels a grievance towards. And that's all mental health stuff to them, right? And it is. They're right about that. Those are, quote, mental health, if you want to use a term loosely. It's not severe mental illness, they're psychological things. So, again, clarifying the legal system does not consider that for things like insanity or for civil commitment. You can't hold somebody in a jail cell or psych hospital because they're, having fantasies of blowing up the school. That doesn't count. They have to actually do something. They actually have to make the threat. They actually have to cross a line legally to have any kind of consequences. So there's this huge chasm in the middle where the doctors like me are like, don't bring that kid to my office. I don't want a school or mass shooters sitting in my office. And law enforcement's going, what do I do with a dysfunctional household and in school feeling ostracized by kids at school? What do I do with that? And so the answer is there needs to be funding for the middle chasm that's missing, which is cops come in, secure weapons and guns, and say, you get those guns out of here for starters. B, we're going to engage with the kid, the family, the school, and get these healthcare workers in. And hey, kid, you have some issues with depression and maybe some other issues that we're going to try to address. And you're radicalized by these depraved subcultures, and we're going to address that too, the way we might an eating disorder, and start programs for this using the model from eating disorders. And because of what you just said, the eating disorder just doesn't go away by giving them a pill, and that those are chronic long term problems. Well, the guy who's radicalized by discord is probably going to have a long term problem too, which is why just knocking on the door and telling them to stop doesn't work. So it needs to be a program, it needs to be funded, it needs to be engaged, it needs to be long term, it needs to have coordination, it needs to have leadership, and it needs to be something that we all get behind as a country because this is our national shame and we need to do something about it.
Absolutely. And just the two pieces I think that the Appalachia High shooting shows need to be part of that system you laid out is child services needs more funding and more education and a standard way to share information. So if a family is bouncing between counties or bouncing between states, you don't have a blank slate every time there's a new child services report. You know that now this is the fifth time the mother said she was going to kill the kid.
Right.
Because if you're seeing it for the first time, you might think it's a one-off. But this information is never getting collected. The same way, we need a federal system of education records. Because if a kid has disciplinary issues, if a kid makes threats, if there are warning signs in one school district, the easiest thing it is for the parents to just go to another school district. And educational records usually don't get transferred, especially between states. So we need better education for frontline police officers to understand problems, more resources for clinicians to be able to treat people that are having a beyond acute clinical issues, but also information sharing. It is not there. It's the same failures that went into 9/11. Are the information is not getting shared.
We may need to pass new laws that give more teeth to some of these programs because, a family could say to a law enforcement agency, stay out of my house.
Absolutely.
There may not be anything that the law enforcement could do at that point. If the attorney calls them up and says, you're harassing or this family, their kid's not a school shooter because the parents are clueless that he
Yeah.
really is.
Or the inverse, which you saw in St. Louis, is the mother said, "My kid is going to commit a school shooting. Please take the rifle."
Yes,
And based on Missouri laws, the police said that he is a law-abiding American. We can't do that.
right. So
So
we've had
these problems are so much bigger than unfortunately we can discuss today. We
yes.
barely scratched the surface,
We
but
didn't get into the gun issue, but I have an idea for that too, and that's to put the guns into classes A, B, and C and require licenses. So instead of getting emotional about banning guns, if we put them into categories, and then let's say that you want to buy an AR-15, well, in my plan, you would have to be 21, you would have to pass a really powerful background check, which means you might need a credit report, a job, some sustained ability to pay your bills and to have stable housing. And, if your neighbors say that they saw you shooting cats in the driveway, that's probably not going to get you an AR-15. So there have to be some guidance for gun ownership. And I'm not in favor of banning them. I don't think we have to ban them. I think we should just have better licensing licensing policies and laws in place that allow people to own these that should own them and keep them out of the hands of the people that don't.
yeah, and absolutely. And I mean, I think we're beyond the point of people being able to say that things are one-offs because they're just continued systemic failures.
I wanted
And
to throw that out there because so many people get emotional about when they talk about school shootings, about guns. That's a place that a lot of people's mind goes to immediately when we have this topic. So it needed to be stated for those reasons. And all of these issues together can be solved. And this is not a right wing or left wing issue, it's an American issue. And we can all come to an agreement on this. I do believe that.
yes, it's as I've said many times, this is not a social media issue. This is not a mental health issue. It's not a red state, blue state, large community, small community. It happens in every part of the country by every color and type and age and gender of students. And it's happened for largely the same reasons all the way back to the 1960s. You can open up one of the cases, strip out the details from the 1960s, read the narrative, and it could be what is playing out on the news a week ago.
That's right. So we call these waves of terror. And there's a book out there by Rappaport where he talks about waves of political and other cultural terrorism. So if you think of the school shooting subculture as terrorism, you can see that's a wave, a subcultural wave that we're in the middle of right now. Similar to what the Palestinians and the suicide bombings, which have largely slowed down or even stopped, we don't see those as much because they come in waves.
Well, before anybody reads that book, I want all of the listeners to check out Extreme Overvalued Beliefs. There's a link in the show notes for it. It was an absolute pleasure talking to you today. Dr. Tahir Rahman is a doctor of psychiatry, excuse me. He's an associate professor at Wash U in St. Louis. He has a wealth of knowledge about putting empirical evidence into preventing school shootings and realizing that we need to address a dangerous, violent ideology, not people who are severely mentally ill. So thank you so much, Doctor.
Thank you, David. Good show.